So holidays are usually a great opportunity to get together with family, and we all enjoy that. In these times, though, we have to be a little bit more cautious, and we have to look about what can we do to protect our loved ones. Before we get together on the holidays, it is important to check what does your state mandate, and also use common sense and caution when you get together. What I want everybody to be aware of is that when it comes to COVID-19, 80% of infected people are below the age of 60, so the majority are probably parents with their little children. 90% of people who die of COVID are above 60, so this is the generation of our parents, our grandparents, our great-grandparents. So we want to make sure that we keep them safe and healthy, and there are a couple of steps we can do to make this more likely. I think one very important step is to ask yourself, do I have any symptoms? Because if I have symptoms, the likelihood that I have either an infectious disease like the flu or COVID-19 is pretty high, and that is definitely not something you want to bring to a family gathering. The next question I think you always have to ask yourself in these times is, do I have anybody that I put at risk? Let's say if your uncle had a heart transplant or a kidney transplant, that would definitely be a person you would worry about picking up an infection. Or if you have somebody in the family who has diabetes and is at a higher age, we definitely want to make sure that we take this into consideration. Now, what you also have to look into before you get to the family gathering is, what is the situation there? Over time, you probably have heard this in the media, there are certain areas that all of a sudden become hotspots with a lot of virus activity, and you want to make sure you're not heading towards one of these areas with a whole bunch of people. Otherwise you put yourself at a high risk of getting infected, and also make this what we call a super spreader event, where you take the disease to a lot of other places very quickly. I think when you meet with family, it is important to see how many people are gathering. Now, of course, the more the merrier. You want to see all your family members, but sometimes you have to take turns and say, hey, we just meet with the kids, or we just meet with the grandparents, because the fewer people are together, the less likely it is that the disease spreads from one to one. So you can be creative how you're going to do this, maybe take shifts on a family meeting to do this. Now, the other thing you want to think about is, where do people come from? So if you, for example, if it would be March again and people would come from New York City, you would think completely different about the situation that as if they would come, let's say, from Alaska, where the disease was not very prevalent at that point of time. So use also caution to see where are all the family members coming from. That is recommended for interaction in public applies here as well. Wear face masks because they reduce the risk significantly that you infect somebody if you're an asymptomatic carrier of the disease, and also protect you to some extent to get the disease. Try to keep social distance of 6 feet or more, and make sure you've got plenty of hand sanitizer around so people can clean the hands frequently. The risk of getting together is really that you spread it at a very close range, and if you abide to these rules, you can have a good chance of lowering the risk of infecting each other significantly, which of course we want to do. Be creative. Look what are activities that you can do that are at a lower risk. For example, if you do a Thanksgiving walk through the woods or through the park on the outside, spaced out, that is a low risk activity. However, if you crowd up each other around a table with no space in between, that's a higher risk activity. So think about how you can be creative in lowering your risk when you get together. When it comes to food, I would recommend be practical. everybody brings their own food or their own silverware. Do not have people share foods or spoons, because that can be risky as well. Look out how people look and behave during the meetings, because if you have somebody who looks sick, I would address that. You know, we don't want to embarrass anybody, but we also want to make sure that nobody gets sick. And I would definitely speak openly about that also with your family members, what we're going to do if somebody all of a sudden turns sick or develops symptoms while you get together, so that everybody knows what the plan is. Plan could be, for example, if you notice that you seek out a physician after the family gathering and look that you get tested so that you don't spread it any further if you would acquire COVID-19. I think the main question that you will ask yourself is, did anybody get sick? That's what we hear most often when people tell us about family gathering and somebody gets sick afterwards. Ask yourself who needs to know that, because if you travel from different areas, it's important to notify the people who were exposed at that family gathering, and also notify their physicians or through their physicians, the public health board, so that they know somebody brought a new aspect or a new case of the disease in the area. It's also important, of course, if you have somebody who's immunocompromised to participate in a family gathering, that they know that they have been exposed, because they have to watch out a bit more closer. And then for yourself, if you find out somebody turns positive, look what you have to do not to jeopardize anybody else in the time being. So look if you should isolate yourself, work from home, or let somebody know that you're potentially infected. But regardless of all we just said, we all wish you wonderful holidays and hope that you can unite with your family, be cautious, stay safe, stay healthy.